Thank you, Presiding Officer. I think what the Cabinet Secretary needs to understand, and Miles-Briggs, is that arguments in the Chamber won't bring back those people who have caught COVID-19 in hospital and who have went on to die. So let's stick to some facts, because I spent an hour on the phone today with a constituent who is absolutely heartbroken. Her mother was in hospital for several weeks, saw no one, was shielded from family and all visitors, was in a room on her own, and she died from COVID-19. It is on the death certificate. So families, like my constituent, they need answers. In this case, my constituent wrote to the First Minister weeks ago, got a reply from an official and was told, if you're not happy, go to the Ombudsman. This is not good enough, Cabinet Secretary. So families do deserve answers, they do deserve an apology, and they absolutely need an independent inquiry to get to the bottom of this, and most importantly, so that we can have confidence that as we restart our NHS, people, patients and staff will be safe. Will the Health Secretary grant the public an independent inquiry, please?
Cabinet Secretary.
So I agree with Ms Lennon, absolutely I agree with her, that none of this arguing back and forward will bring back people who have died as a result of this pandemic, whether it is a result of nosocomial infection or whether it is the impact of the virus on them in another regard. And that is a huge matter of regret. And I also agree with Ms Lennon that people do need answers. And so when the data is validated, we can have a conversation at that point on two matters. First of all, around the actual numbers that we're talking about. Secondly, why do we think that happened? What is the nosocomial group doing and what are they telling us, me, but also you, because we will make that information available about how the virus was transmitted in that hospital setting. It may have, there are a number of possibilities there. I'm not going to speculate on them, but I'm sure Ms Lennon knows them as well as I do. So what is their view about how it could be transmitted? Therefore, what is their view about additional steps that we should be taking? Because I have asked them to do both. I've asked them not only to consider, once the data is validated, but they're considering it now, in what way do you think it is possible the virus has been transmitted in the hospital setting, and what more, other than what is currently being done with those red-green zones, or hot-cold, as they're called in some places, with the infection prevention and control, with the supply of PPE, what more do you think we need to do in terms of additional environmental cleans on top of it? Testing of staff absolutely is part of it. The wearing of masks in all clinical settings and in non-clinical settings, including in staff canteens and so on. All of that information will come shortly to me. I am very happy to share that with Ms Lennon and with others. And let's see then if there is more that we can do to do two things: to try and give an answer to her constituent and also to my constituent who wrote to me last night on exactly this matter, to all of those families, but also to be sure whether or not we are doing everything we need to do. That's what I want us to focus on. Whether or not there is an inquiry into any aspect of how this pandemic has been handled by any party, whether it happens in near time or in more distant time, will be a decision for another day. What I need to do right now, as I'm sure Ms Lennon would agree, is focus on what do we need to do to ensure that we mitigate and minimise the possibility of nosocomial infection in our hospital and healthcare settings. That's what I think we should have our next conversation about.
Thank you. There are 5 more members.